If you have knee arthritis, you might be looking for options to stay active, play sports and exercise, and avoid knee replacement surgery. In this video, we'll talk about some of the other innovative treatment options out there in the world of regenerative medicine, including peptides, PRP, exosomes, and much more. I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, knee arthritis is a very tricky problem, and I've talked about this in my hip arthritis video and a number of other videos on this channel, that yes, a lot of orthopedic surgeons use the wear and tear analogy, the tread on a tire, so to speak. The tread wears out, then you have to replace the tire, but that's a little misleading. Osteoarthritis is more of an inflammatory issue where you have inflammatory cytokines and degradative enzymes just chewing away at the bone and cartilage. And if you don't stop that process, even if you do a knee replacement, all those cytokines and degradative enzymes start to work on other joints, and you end up needing the other side replaced or your hip replaced or things like that. And so that's where accurately treating the problem is helpful. Now, some of the treatments that we typically use, that orthopedic surgeons typically use, are things like cortisone shots, which may give you a little short-term relief, but have definitely been shown in the scientific literature to speed up the development of arthritis and the need for knee replacement. Things like hyaluronic acid injections, or a series of those injections, may have some relief, probably not that much in long-term change, but can be effective. And both of those are covered by insurance. Going in surgically and cleaning up the knee with an arthroscope, that typically is frowned on. I know it's very commonly done, but numerous studies have shown that that may actually speed up the development of arthritis and offers very little, if any, pain. And then, like I said earlier, the end result of this is typically knee replacement. Now, one of the problems with a knee replacement is there's a 20 to 30%, depending on the study you read, 20 to 30% dissatisfaction rate with that surgery 12 months out. And the younger people are, so that people in their 80s, very satisfied with their knee, even though they're the riskiest patients in terms of morbidity, but they're the happiest. People typically in their 60s and lower, very high dissatisfaction rate. So I'm a big believer, push that surgery out as far as you possibly can, and do what you can to stay active. Now, in terms of other treatments out there, some of the regenerative treatments, there's a number of different things to look at. And I've got videos on some of these specifically, so definitely check those out. There's a medication that is available from compounding pharmacies. You can have your physician, your MD, probably not the orthopedic surgeons, but maybe prescribe it from a compounding pharmacy called penisin polysulfate, given as a subcutaneous or intramuscular injection, has been shown to be very good at stopping that inflammatory process that's chewing up the bone and cartilage, very good for osteoarthritis pain. It's in phase 3 trials with the FDA, at least at the time I'm recording this video. So hopefully it will be approved and available from traditional pharmacies and hopefully paid for by your insurance, but that's still maybe a little ways off, but can be very helpful. Now, other things that people ask about and that people try. Peptides. Would peptides help? And I've got lots of videos on peptides and what they are. Short chains of amino acids. They're substances naturally made in your body. They tend to decline with age, but labs have figured out how to make basically synthetic versions of those peptides that are given essentially as a medication. And you get peptides basically as a prescription. I would very, very, very strongly recommend you see a physician, in this case, maybe an orthopedic surgeon, certified in peptide therapy, who prescribes that peptide, whichever one you decide to get, from a legit compounding pharmacy. I know I'll get a lot of anger about that from people that say, hey, I'm just going to go online and get it from some shady site. Again, none of this video is medical advice, but I do not think that's a great idea for what that's worth. Peptides, though, as something that you give yourself, usually as a subcutaneous injection, may or may not be helpful with knee arthritis, might help relieve the pain a little bit. But I do wonder about the effectiveness of trying to get in a joint with something that's not given into the joint. So it may play a role. Now, there is a study, probably I would argue maybe not the world's best done study, but there was a study a year or two ago looking at injecting a specific peptide, BPC 157, into the knee for all different causes of knee pain. And the person that did it was not an orthopedic surgeon, so he didn't really know what he was treating, didn't get x-rays, MRIs, and there was no control group. But what he did find was that there was a significant pain relief, whether it was just BPC injected into the knee or a combination of BPC and TB4, thymosin beta 4. So that potentially could be an option. You would not be able to inject yourself directly into the knee, or you definitely shouldn't. The infection risk would be super high with that. That would be something, again, the physician would order the peptide, have it delivered. You'd go to his or her office. They'd sterilize that part of your knee and inject it into the knee. That potentially could be an option. As far as other regenerative treatments, things like PRP, things like stem cells, things like exosomes potentially. PRP is a little more accepted. That's where we draw up a little bit of blood from, basically a blood draw like you're doing labs. And then that blood is spun in a centrifuge to get rid of the red blood cells, get rid of the white blood cells. And what's left is the clear yellow part of blood, the plasma that has platelets, now very concentrated platelets with all their growth factors to try to get the bone and cartilage to heal. The studies for a variety of types of arthritis are showing fairly good results. It's not overwhelming, but potentially can be as good or maybe a better option than hyaluronic acid or cortisone. Certainly none of the downsides of cortisone. It's not covered by insurance. It's something you typically have to pay for, but that can be a reasonable option. And a number of different orthopedic surgeons do that. As far as stem cells, like stem cells from amniotic fluid or exosomes from amniotic fluid, there aren't many orthopedic surgeons doing that, though. The few orthopedic surgeons sort of doing the stem cells typically are getting them from basically drawing it from your bone marrow and injecting that. And the studies are reasonably good for that. Again, they're early. And again, that's considered an experimental procedure. Exosomes and the stem cells from amniotic fluid or stem cells from fat, that is definitely considered experimental by the FDA. All of this regenerative medicine, these treatments are considered experimental. You should definitely know that. But at least theoretically in the early animal studies and even early human studies in the case series show good success rates in terms of pain relief and hopefully improving people's functional ability. And what you're hoping is maybe a regeneration of some of the bone and cartilage. I always tell people when they're thinking about any of these, your goal is not necessarily to get your knee back to the way it was when you're 18. That might be unreasonable. But if you can play tennis or pickleball or golf or whatever your activity is a little bit better and push that knee replacement off, potentially it can be an option. This is not medical advice. I'm not pushing any of these treatments. I would strongly encourage you, again, this is not medical advice, but I'm encouraging you, talk to your orthopedic surgeon about your knee arthritis and about the different options, pros and cons of all of it, including pros and cons of knee replacement, because there are risks, as I talked about earlier in this video. And then if you decide, hey, I'd like to proceed with some of these experimental treatments, find somebody, preferably, again, an orthopedic surgeon that is experienced in this, certified in this, knows exactly what you're treating based on exam and x-rays and MRIs. And then you two come to an agreement on what's best for you and proceed accordingly. One of the appeals of the regenerative treatment options is there's really not huge downsides. Yes, when you inject something into a joint, there's a very, very small risk of joint infection. That's true with cortisone and hyaluronic acid as well, but that's very low. The biggest risk with these regenerative treatments would mostly be you spend a lot of money. These are expensive treatments not covered by insurance, and it may not help that much. And that's always a risk with any medical treatment, certainly a risk here. But just wanted to put all this information out there so that you could sort of go to your doctor, go to your orthopedic surgeon, say, hey, what about this treatment? What about that treatment? And not just take the one treatment that doctor offers you. Okay, I'd love to hear your experience with your knee arthritis, your knee pain, and if you've had regenerative treatments, let me know that as well. Leave those in the comments below. Just understand, if you leave a question in the comments, I can't give you medical advice, but I do try to answer your question in a future video. Make sure to subscribe to this channel, click the bell to be notified, when I release a new video and when I start a live stream like my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.